Judy L. Jones Show, and I'm in conversation with Dr. Heather F. Hines, creator of One Love Midwifery, practicing out of Yanpank, Long Island, New York. One Love Midwifery is a Black-owned business. And after watching this video, hopefully you'll be inspired to open one of your own. Dr. Hines is a fierce Jamaican-born midwife who has a thoughtful, level-headed approach to birth and to the health care of women. In this conversation, we touch on a couple of topics to include the differences between a doula and a midwife, and what exactly goes into the holistic healthcare approach from puberty to menopause. You can find this and other videos of mine under www.judyljoneshow.com. Scroll down to the bottom of the page, click on the links, Facebook, YouTube, and Instagram. And when there, make sure you like, comment, and subscribe. So hi everybody, so we're back and I'm speaking to Miss Heather, and she's going to elaborate on some questions that I had posed prior and trying to get everyone to understand what exactly is a midwife, what do they do, what is their particular mission, particularly a mission for someone who has their own business. I'm a nurse practitioner, all right? So nurse practitioners can work in different genres. Midwives work under the tutelage or in the area of GYN obstetricians. Okay, so Miss Heather here is going to explain to us specifically what is a midwife and how this definition underscore her mission statement that midwives don't just deliver babies.
So hello everyone, and thank you Judy for allowing me to be here with you today just to shine some light on midwifery here in America. So a midwife is an advanced practice provider. As I will talk about here in New York, I am a midwifery educator. That means that I am in a graduate program in the School of Nursing, teaching registered nurses that have a baccalaureate degree how to become a midwife, and when they complete the program, they gain a master's degree. Midwives need to pass a certification exam to be able to practice. Then they need to apply for licensure in the state for which they're going to work. In some states, they're under the School of Nursing, like the Department of Nursing. In New York State, we actually have a Board of Midwifery, so we're under a Board of Midwifery here in New York State. I didn't know that. In New York, speaking because that's where we are, we're independent practitioners. That's right. So just like I did recently, I can go hang a shingle on a door and say, you know, nurse midwife or midwife working here. 95% of midwives are working in a hospital or working in an outpatient clinic office. And there's a small percentage, I'm hoping to strike a match under more, but a small percentage that open their own practices and provide comprehensive gynecological care and obstetric care. So what does that encompass? Gynecological care is anything from the first pap smear to the diagnosis of a urinary tract infection, a vaginal infection, maybe it's a lump in the breast, maybe it's pregnancy spacing or contraception, maybe it's am I pregnant or I don't want to be pregnant. It takes through the 9 months of pregnancy. It's the delivery of. We are the specialists in low-risk patients and know how to collaborate and refer if we need to. And then we take care of the birthing individual postpartum, and our regulations allow us to take care of the newborn from day 1 through day 28.
Isn't that something?
Yep.
Through day 1 through day 28. Yep. Are you guys also the educator for the doulas?
Nope, doulas are a separate entity that are not healthcare professionals, but they're an integral part of the team. So doulas, and I need to explain that. Midwives are healthcare providers. Doulas are your support person, your educators. Those doulas go through training on how to deal with psychological, how the mind goes through birth and postpartum and breastfeeding. They know the tricks to get a baby into the right position.
Wow.
They know how to get the birthing person comfortable. So doulas have been studied and know that when you apply a doula, which is your personal support person, they help to decrease your need for medication. They help to decrease your likelihood of a cesarean section, increase bonding and breastfeeding, and help to decrease postpartum depression. So a doula is a great addition to your healthcare team.
So are they found by the mother, or are they recommended by the midwife or the obstetrician?
Both. Doulas are recommended by healthcare providers because your healthcare provider is watching your status, meaning your blood pressure, your pulse, your temperature. They're watching what's going on with the baby in your uterus, like how's the baby's fetal heart tracing, how's your contractions going. Your doula is there to say, let's change positions, let's go to the bathroom, let me rub your back. They're the person that's going to support you. My slogan and my take all for all people is every birthing person in the world needs a doula. A doula is going to be the person that's going to help you to be successful.
Wow, so they are an integral part of the team.
Absolutely.
See, I didn't know that. So I thought that a doula was just something other than what you just said.
Mm-mm.
It's like a friend or
Correct.
someone, but it's more than much more than that.
And the thing that's really awesome is they also help to fortify who your support person is. So if it's your significant other, they might whisper to the significant other, let's get up and do a little dancing, or maybe rub the back. They're the coach that's going to help the coach.
Excellent. One Love Midwifery was co-founded by you especially to address maternal mortality statistics in the U.S.
Mm-hmm.
Heather, are those numbers still alarming?
Alarming. BIPOC, Black, Indigenous, people of color are dying in extraordinary numbers. And I was in a practice where I stayed for 19 and a half years. I wasn't seen. I didn't have the ability to make change. My students called me out and said, Dr. Hines, what are you doing to help increase awareness to midwifery and decrease morbidity and mortality? And I'm like, I have no power where I'm at. So I started my practice to be able to have me as a Jamaican American in my community as a face for brown and Black patients so that I can truly see them. In turn, by me stepping out of my comfort zone, I'm hoping to ignite a fire under more providers that look like the community that needs us, the community of need, so that they're able to provide care. Statistics shows that people who go to providers that look like them have better outcomes to decrease what we call the lived experience.
Yeah.
Brown, Black, Indigenous people, they're still to this day not believed for the conditions for which they complain about. Little things that if you spent 5 minutes with them, you'd be able to say, ooh, we could mitigate that, we could change the course. Until we can have people in every community having providers that look like them, then we have equity, and morbidity and mortality here in America will totally decrease.
Because I know how I feel walking into a doctor's office, someone who looks like me. Number one, you feel comfortable. And number two, if you're aspiring to be what that person is, then you say, hey, if that person who looks like me can do it, then I most definitely can do it.
Correct.
You can be her. Okay? He can be he, depending on who you're looking at.
Right.
It does something to the visit. It does something when I walk in. I say, "Oh my goodness, this is Dr. Hines,
Right.
and she looks like me. So we can chat it out. We can yap it out.
Correct.
I don't have to be so tense and so tight."
Correct.
So a Black brown woman going into a doctor's office will get a different experience than the white woman.
They will. Their stress starts from the call, right? Their stress starts from, can I have your insurance card? Are you on Medicaid or private insurance, right? They're already stressed about coming in. So with that lived experience, brown, Black, and Indigenous people come in with stresses, just leaving their house and getting to the visit. Will they have violence or harm getting there, right? You get into the office, if you maybe are a little overweight, do they have chairs that can fit you?
Oh, something as simple as that.
Or how about now that we make it so easy for everyone, we put the scale out in the hallway and you have people now in front of people trying to hide your weight because everyone now knows it. So the ability to have a provider that looks like you, in an environment that you're comfortable, your blood pressure comes down, your pulse comes down,
Right.
your
Right.
stresses of the day get to vanish away because they understand that the lived experience is a serious thing. We have good allies as physicians and advanced practice nurses, but yet our allies still don't know the stresses we have to take just to come out into the world and be seen by the people around us.
So if I'm walking into the office and I had a bad moment or I had a bad experience getting to the office, I'm able to sit down, take a breath, and say, oh my goodness, okay, she looks like me, then maybe she's going to understand what I just went through. Oh my goodness. I know where I work right now as an adult health nurse practitioner, bringing in the guys and gals to be prepared for surgery. I try to be as calming and effect as possible because I know that they're feeling already tense about a surgery. I mean, that happened to another, couple of weeks from now. So if I start it off right,
correct,
then the journey to the procedure, the journey to the baby, will be smoother,
correct,
than when started.
Absolutely. And one of the things that happens is, and I'm sad to say this, but it's the truth, healthcare in America right now is still not for the health of America, right? Our templates, our day's schedule, so our templates of work are not set up for the health of you. It's set up to bring big business and money into the corporation, right? So if people can understand that when you come, we are already overbooked before we even saw you.
That's it.
We already know we're overbooked, so that stresses out people, stresses out the provider, and the provider is now, trying to get through their day because they don't want to bring home any of that work to their house.
Right.
I needed to get away from that, right? The way to help mitigate risk is taking time with the patient, is developing trust, it's that exchange. When patients come to my office, please don't look for the scale right away. Please don't start taking your clothes off for me to look at your belly. Let's sit for a minute.
Oh, wow.
Let's peel off some layers of the onion. How are you doing, right? Like sometimes I have to ask my patients 3 times, like, no. I'm not getting up right now. Like I'm sitting, right? How are you doing? How was your week? Are you afraid of anything? Are you feeling safe? Like and then they're like, okay, wait a second. She's really not gonna touch me. And I'm like, yeah, I'm really not gonna touch you right now. Give me 10 minutes. I need to feel how your energy is before we start anything out. But honestly, in America, there's not too many people that can do that. And when people set up their own practices, that is what they're looking for. They're looking for building community, curing one patient at a time, improving the outcomes, improving success, right? And success for someone might be, I don't gain too much weight in the pregnancy or have a safe vaginal birth. So take time when you go to facilities, bring your questions. Ask the provider to sit with you for a minute. Like I know you have other patients, but maybe if you answer these 2 questions, we can develop a relationship. But remember, in America, you're in practices. So as you get to know one provider, also try to get to know a few of the others because you might not know who's at your birth. And what's really nice with midwifery practices, the midwives, our visits are typically longer than our physician colleagues, and we take time to get to know our patients because we're about building community.
Right, and as a nurse practitioner, as a nurse, we tend to look at the patient globally. We tend to look at the patient from a broader view, right? This is why I get comments all the time from patients that say, oh my goodness, you spend so much more time with me than the doctor.
Correct.
Right?
Right.
And one of the things that I remember, Maya Angelou said, people will not remember so much as what you said to them, but how you made them feel.
Amen.
Right? I think about that whenever anyone comes into my office.
Right.
If you leave feeling differently than when you walked in, that changes your whole outlook for number 1 for the day.
Right.
For the day. And number 2, for the facility or the institution or the practice you walked into.
So we're decreasing stress, right? And we're increasing resilience. And as nurses, yes, I'm a nurse midwife, but midwifery started way before nursing. We're not gonna, that's gonna be the second interview. But with nursing, we're looking at diet. We're looking at stressors in the community.
Yes.
Take a minute to unpack. How are you mindful? Right? By asking some of those questions, it helps the patient. One, we're educating.
Yes.
By educating, we're improving outcomes. By being kind, we're improving outcomes. By listening, we're improving outcomes. So I'm grateful for the ability that we have nurses paired with our physician colleagues and advanced nurse practitioners, because in a well-oiled machine, all aspects of the healthcare come together.
Right. Everybody works together. There is not one snatch over here and one crumb over here. We're all in it together. And if the patient feels a type of cohesiveness, teamwork, right? It smooths the journey from A to Z. And that's what we want.
That's all we want, right? We all can't do it alone. Meaning, like, yes, there's a small percentage of healthy patients that never need to see a physician.
Right.
They do what they need to do. But, you know, we're in a society now where people are overweight, people have diabetes, hypertension. Lived experience is a true thing. People still don't believe that brown, black, and indigenous people have pain and bleed and die. So until that day is true, we need the collaboration of nutritionists and social workers and physicians. And we need community, you know, people that come into the home, like postpartum doulas and lactation consultants. We need people who specialize in mental health. All those facets help to make wellness and make a whole person.
Make a whole person. It's the whole person. And segueing to that, holistic GYN care from puberty to menopause. That's part of your practice as well.
Correct.
What goes into those visits? Some of what you just said a little bit?
It absolutely does, but my visits are a little bit longer. And when you're going to a practitioner that believes in the wholeness, what are you drinking during the day? What are you eating? Are you exercising? What feminine products are you using? Are you using feminine products? How is your sleep? Right? How much caffeine do you take? What herbs are you taking? Are you seeing an acupuncturist, a chiropractor? You know, we're looking at all the aspects, and then we give little nuggets. We're not telling you need to do. We're giving you what's called informed decision-making process. And once you know the tools, then you're able to improve your outcomes. So evidence-based. Everyone thinks that you have to have a pap smear every year. That is not true. Guidelines have changed.
That's right. That's right.
Patients go places, they think that if you draw their blood, they got an HIV test. No, we have a conversation about the risk. Do you need to have an HIV test? We talk about nutrition and supplements. If you're eating a well-balanced diet, do you need vitamins? No, you pee those out. But if you don't eat anything and broccoli, listen, I'm on a soapbox with the broccoli. Broccoli is green, but it's not gonna help you. So if you're walking around saying, I eat greens, broccoli every day, no, I'm talking about like kale and, you know, collards and spinach. Right, those are the good things. So a holistic GYN visit takes all the parts, the nutrition, the activity, the mental health, the physical, all the things, and we put that together to make sure that you're on a good plan, and then we follow up with it. In a year, sometimes you don't need to have an internal exam or a breast exam, but maybe we need to talk about, you know, what stressors are in your life. Are your vaginal secretions okay? Do you feel a little itchy? How's sex, right? My biggest joke with some of my patients over 45 is I'm like, sex turns into physical therapy after a certain amount of time, right? You still gotta do it so you don't lose it. We wanna keep that vaginal tone good. So sometimes the conversation shifts a little bit. That's what holistic GYN is.
It makes you feel so much comfortable when you can laugh. Like,
absolutely.
My God, this woman, I sat here for 30 minutes and I don't feel so crazy anymore. I feel chill because she's making me feel comfortable. And listen, it all starts at the front of the office. Whoever you have in private practice, institution, facility, whoever is at the front of your office, your welcoming person, that person sets the tone for the patient before he or she gets into the office to see the practitioner.
Correct.
That's very, very important.
And I'm going to apologize again for general medicine, like everything out there, because a lot of times they don't pair the right wine with the right food, meaning the front office staff doesn't always reflect the provider that you're going to see. So be patient, right? Like don't rate that person for the care that you're going to get when
Correct.
you go behind the doors.
Correct.
In my small practice, I am the cook, the bottle washer. I will shine your shoes. I will fluff your pillow and leave a mint. Until the day that I get some money and get some other people. And they're gonna reflect me in my craziness. But for right now, I'm grateful in my practice that I am that person. I'm grateful that every patient that comes to me, I have enough time to be able to spend with them, because at the end of the day, providers are looking for that positive thumbs up that you're doing well, right? And by making people comfortable, making people you're seeing them and hearing them, that helps to increase their longevity and increase their or decrease their lived experience.
And plus, like I said before, it's not what you say, it's how you make that person feel within those 5 seconds, 5 minutes, 50 minutes in your office. If you don't take anything away from this interview, take that away. Miss Heather, how does the lovely patients, to continue this conversation, how do they get in contact with you? What's the best way to reach you?
So the best way to reach me is you can hit up my website at onelovemidwifery.com. Follow me on Instagram or Facebook. You can also contact me through messaging there, so at onelovemidwifery.com. If you are thinking about becoming a midwife, you are looking for a midwifery program, I am the Stony Brook Midwifery Program Director. In the United States right now, I believe there are almost 47 midwifery programs in the United States. Out of that, there's less than 5. There's only 5 BIPOC midwifery educated program directors out there. We deal with equity, right? Midwifery is the true profession that brings equity back into care. So if you're thinking, I'm a nurse and I want to do more for my community, what about midwifery education? What about women's health nurse practitioner?
Correct.
What about family nurse practitioner, right? So if you're thinking about that, you can find me through the Stony Brook School of Nursing webpage and send me a message that way also.
So, ladies and gentlemen, we appreciate you taking the time to visit with Judy and Heather.